you may have to wait a month longer than planned for your COVID vaccination. That's because of a significant reduction in supplies that will affect how many jabs can be given in April. This is how the Health Secretary Matt Hancock explained the hold-up at yesterday's Downing Street news briefing.
Vaccine supply is always lumpy. And of course, these supply schedules have moved up and down throughout this whole rollout. It's absolutely par for the course. We're on track to meet the target of offering to all groups 1 to 9 on the 15th of April.
Let's speak to Dr. Ammara Hughes, GP and Clinical Director of Central Camden Primary Care Network, who runs a vaccination hub about all of this. Dr. Hughes, good morning. Thanks so much for talking to us today.
Good morning, Vanessa.
And also for all your sterling efforts vaccinating the residents of Camden. Superb.
Thank you.
Were you taken aback and shocked at the news that there's going to be a supply blip?
Yes, sadly we were. It is a little bit frustrating. However, what I can say, what we are very pleased to say, is we are now in a position to focus on second doses because we're approaching the 12-week mark for a lot of patients. So it's not that we don't have any vaccines; it's we don't have enough supply to continue on the first doses just yet. But it means we can now focus our efforts on getting through as many second doses as we possibly can in this time frame.
Right. And is that of both vaccines that are available?
At the moment, yes. So we had, I can tell you from my own experience yesterday, we had delivery of both Pfizer and AstraZeneca. So over the next few days, we will be vaccinating all of our over 50s with some of the AstraZeneca, and we'll be inviting our patients who are due their second dose of Pfizer for their second doses. So we'll still have plenty to do, and I understand it's disappointing for patients under 50. But the other thing that we've also done is people with a long-term condition who are in that under 50 age group, a lot of them have already had their first dose of a vaccine as well.
Tell me about the second doses. The government has undertaken to give them within a 12-week period. Is the government legally obliged to ensure that anyone who's had the first must have the second by 12 weeks?
Now that I'm not sure whether they're legally obliged, but what I can say from personal experience is we're confident we can deliver all of our second doses within our 12-week guidance.
And explain about the second dose and why it's very important for people to trundle off and get it. Because I wonder whether some people will think, oh, well, I've got 83% protection now. So, it doesn't matter to me much if I get the second one. Why does it matter?
So it matters because we want as much protection for the whole population as possible. And we don't know, we're coming to the end of a second wave, thankfully, but we don't know how much COVID is still going to be around. We don't know how many new strains might appear. So it's important for all of us to get as much protection as we possibly can. Remember, these jabs don't necessarily stop you getting COVID itself, but it will stop you getting sick from COVID. Yes. So the higher the percentage chance of you not getting sick, the better it will be for us personally, and the more we can get on with our daily lives and open up and do all of the things we really want to do.
And tell us about supplies and how it works. And, we heard at the beginning of some of the vaccine, the precious vaccine being wasted because the Pfizer has to be stored at such very low temperatures. And sometimes, all of the people who were called wouldn't show up on the right day. Then we heard of other people saying, well, it doesn't matter because if we haven't used them all, we ask the people in from, the care home over the road or NHS workers from the nearest hospital or just people who are of a lower age group on our list. I think networks, vaccination centres got much better at using every last drop. Is that right?
Yes, very much so. I think what happened initially, if you remember, we had to roll this out very, very quickly. It was actually so good that we got a vaccine out before we were expecting to get a vaccine out. Yes. One of the busiest times of the year. And of course, we only had a few days to get our systems in order. And over time, we've got much slicker at our call and recall process. Obviously, the general public are very, very happily coming forward for a vaccine, which is great. Yes. So our ability to book people in advance has got much better. So you're right, we had a few teething problems, but very, very pleased to say there's been very little wastage in terms of
Well,
vaccines.
that's fantastic to know. Absolutely superb to know. So what about this? I'm calling it a blip. You could call it whatever you like. You're the person at the front with all of this. What would you call it? I mean, I think many people call it very disappointing, because if you're under 50 and you were really thinking, good, within the next couple of weeks I'm going to be vaccinated, it's not going to be as soon as you hoped. So do you know why, or what the reason is for this?
Vanessa, unfortunately, we only know as much as you, which
Right.
is the supply chain in terms of various countries and manufacturing issues, and I guess it was always it was always something that was a risk, and we only get our schedules on a week to week basis, and part of that is because obviously now the whole world is opening up to a vaccine program. So I suppose it's understandable that we might have, as the health secretary described, a lumpy supply. And I can appreciate people are very disappointed, but I also think we just need to just put it into context that it probably is a few weeks.
Yes.
And I think those people who are anxiously waiting for their second dose, I think one of the things that we can at least say is those patients will be invited for their second doses, and it gives us an opportunity to catch up. Remember, we're ahead of the game. We're ahead of the game here. We're ahead of schedule.
And tell me something, do you know about the rollout of the second dose? I mean, you've got yours now, you say, so that's great. You can give them out at the Camden Primary Care Network. But is there a possibility that some people, I don't know whether in London or elsewhere in the country, might be told, yes, you are due your second dose, but actually we haven't got it yet? Could that be happening?
It may be. I can only speak from my area because our supplies in North Central London on a weekly basis seem to be fitting with where second doses are due. But
Yes.
What we're hearing centrally is that shouldn't be the case.
Right.
So I'm really, really hoping that everybody's experience is the experience that people will have in my hub.
So if someone or patients were to come to you saying, look, we're due our second dose, this is our card showing that we had it, and you can check our NHS, thingamabob to show that we've had the first one. But the hub that gave our first one says they haven't yet got supplies of the second. Would you be happy to say, well, all right, you're here and we've got the vaccine, we can give it to you, or can you really not do that? How does it work?
We probably won't be able to do that because we're only getting supplies for the patients that we have vaccinated. So my second dose supply is based on the population that we gave our first doses to.
Right.
So I wouldn't encourage people to do that. I would contact where they had their own first dose just to see what the situation is. But my advice would be confident that you will get your second dose, because all of the indications are that second doses will not be delayed. It might change in a couple of weeks, but right now we're very confident we can deliver on second doses.
All right, let me ask you about the 17 countries in Europe and beyond that decided to put their rollout of the AstraZeneca Oxford vaccine on hold. I mean, you're a doctor, you're in charge of this Central Camden Primary Care Network rollout of the vaccine. You're obviously delighted at your huge achievements in vaccinating so many residents of Camden. What do you think of this? We're finding it so hard to understand why, given there doesn't seem to be any link at all to the vaccine and blood clotting issues.
Yeah, it's I can imagine everybody's just mind boggled by what's coming out of Europe.
Yes.
Look, some of the cases, I can understand why some of those countries have done what they've done. There were a few cases of quite serious thrombosis reported and a few deaths, and I guess some countries felt it was right and proper to pause and have a look at the data. But all of the evidence is saying there doesn't seem to be a link between the AstraZeneca jab and those clots, because clots would happen naturally in the community, for a certain number of people. However, if there is any possibility that there's a link, every country has the right to say we need to make sure that we stop and pause and have a look at this properly and make sure it's safe. And that's what they've done. And remember, other countries are behind us. We've done millions and millions of jabs. And in my own hub, what I can say from a numbers point of view, we've done 12,000 vaccinations.
Yes.
8,000 of those are AstraZeneca. We have not seen a single case of a blood clot. So the risk is very, very low. This is a rare event, if at all connected to the vaccine. So my advice is to everybody, please come forward and have the vaccine, because you're far more likely to get a blood clot as a result of COVID than you are as a result of a vaccine.
I mean, we have heard of some people cancelling their appointments, which I think is tragic. I really think it's the most terrible shame if disinformation emanating from Europe for reasons that nobody seems to be able to explain or comprehend. Yes, there are theories, but nobody really knows why they're doing what they're doing. If they should put the life of somebody in Camden at risk, what a damn shame.
Well, it's hard for people to understand when these stories are coming out. All I can say is, when you're invited for a vaccine, if you have questions, please do speak to the health professional who can give you the facts, ask the questions that you're worried about. I've had people who've been worried and have been ringing me. And after a conversation, as long as you present people the facts, people are more reassured. And I think this is where general practice has a great role to play, because we're a trusted part of the community.
Yes.
So if you're invited for a vaccine and you're worried, have a chat to the person who's calling you up and ask all the questions that you're worried about, because we can give you the right information to help you make that decision.
And you know, we've heard about the hard to reach communities, particularly some African communities and some Muslim communities from all different countries of origin originally. And people have been born in this country and feel reluctant and have been quite unapproachable. And in fact, we heard from a lovely daughter saying, you know, gosh, you know, I've got like 4 brothers and sisters. We've all tried to persuade our mum. She's a Tamil speaker. She just won't have it. You know, we've explained and we've tried. Have you been successful, do you think, at persuading people who are initially reluctant to have the vaccine?
So, yeah, those stories, we hear those stories all the time. So in my area, we have a high Bangladeshi population.
Yes.
And I'm really pleased to say we've worked really hard with that community, answered their questions, and we've got over 75% of our Bengali population in my area have taken up the first dose of the vaccine.
That's
50%,
great.
It's amazing. And
Yeah,
50%
that's
of our homeless
fantastic.
population.
Oh, that's
50% of our homeless
brilliant as
population.
well.
So it's how the information is given, giving people the opportunity to ask questions, listening to them, and also making sure that we have people from their own community answering the questions. So we worked with our local mosques, we've worked with our local churches, we've got people from various ethnic backgrounds who are our vaccinators, who can speak different languages. I've got some Somali-speaking vaccinators. I've got people from the Black, African and Afro-Caribbean community who are doing the ringing, inviting people for their vaccines, so people have an opportunity to speak to somebody who they relate to. And that makes a massive difference.
The Orthodox Jewish community has been hard to reach, the Haredi Jewish population, hasn't it?
Yeah,
and we,
very
in
much
fact,
so.
there was an item on the BBC about it, a 64% kind of infection rate as opposed to, you know, far lower in the general population. Have you had to manage to, you know, make contact with the Orthodox Jewish community and persuade people to be vaccinated?
So some of my colleagues in Camden and North Central London have done that, where those communities are more prevalent. So I haven't had to personally, because that's not the main population in my demographic. But in the whole of Camden and North Central London, yes, people are outreaching, and you've heard of things like pop-up sites and people working with mosques and synagogues, and so people are reaching out to those communities with different ways, going out and asking them questions, going out and working with the faith leaders and community leaders to help support giving the right messages to the community, to people that they're listening to and people that they're relating to. So that work's happening.
Well, thank you so much. Good to talk to you, Dr. Ammara Hughes, their GP, Clinical Director of Central Camden Primary Care Network. She runs a vaccination hub, and she says they are ready. They've got the stock to give out their second jab to the people they've already jabbed. And she's hoping that this delay in jabbing the under 50s won't have too much of an effect, considering we're still in lockdown and nobody's supposed to be mixing with anybody else anyway. Maybe, you know, people will just be extra careful for another month. Let's hope so at any rate. Let's take a trail.
BBC